Well, just when we thought we'd heard it all about the disastrous effects of unscientific lockdowns, along comes another bombshell. And this one raises all sorts of important questions. I'm Bev Turner and this is GBN Originals. Now, new research has revealed that prescriptions for ADHD medications have nearly doubled since the pandemic began. That's right. While we were all locked up in our homes, supposedly for our own good, we were cooking up something sinister for the future. So according to a study by researchers from Aston and Huddersfield universities, prescriptions for ADHD drugs in England shot up from 25 in every 1,000 people in 2019 to 20 to a whopping 42 in 1,000 people from 23 to 24. Now, that is not just a small increase. We're talking about an average annual increase of 18%. And the researchers themselves called it significant, but I would go a step further and call it terrifying. We're looking here at hundreds of thousands of people suddenly being prescribed powerful medications to help them focus and to control their emotional impulses. But nobody seems to be bothered about asking why. The researchers found a strong association between the impact of the COVID-19 pandemic and the worsening of attention deficit hyperactivity disorder symptoms. Now, this is hardly surprising, given that we've forced healthy people to stay at home, doom scrolling through social media, eating too much sugar and blowing up normal routines and social interactions. It is literally a recipe to create ADHD symptoms in anybody, never mind young people. The study points out that lockdowns dramatically altered daily routines, the kind of routines that everybody, not least the young, require to stay grounded in a healthy psychological state. Our kids were torn away from their classrooms and their friends. They were left to navigate the confusing world of online learning and none of the timetable that normally keeps even the bounciest of kids on a sort of daily pathway. Is it any wonder that people's attention spans and ability to focus went out of the window? And let's not forget the deliberate stress, the constant barrage of doom and gloom from the media, the fear of catching a virus that we were meant to cower from, the financial worries as businesses shuttered and jobs disappeared. It is enough to make anyone's head spin, let alone somebody who might have been already struggling with ADHD symptoms. Now, before lockdowns, it was estimated that about 5% of children in the UK, that's around 700,000 youngsters, and 3 to 4% of adults had ADHD. These new figures suggest that those numbers are very much on the rise. And while the researchers can't give us an exact count of how many people are now taking these drugs, the trend is clear as day. But here's the million-pound question. Are we really seeing a sudden explosion in genuine ADHD cases, or is something else going on here? You see, the researchers suggest that the changes brought about by lockdowns may have exacerbated ADHD symptoms in some people, making those symptoms more noticeable and prompting individuals to seek diagnosis and treatment. And while that might be true to some extent, I can't help but wonder if we're looking at this all wrong. Could it be that what we're calling an increase in ADHD is actually just a normal human response to an absolutely bonkers, unprecedented situation? Is it possible that our otherwise healthy brains, evolutionarily designed for social interaction and varied environments, simply short-circuited and rebelled against the monotony and isolation of lockdown? We atrophied normal neurological development, swapping classrooms and textbooks for Fortnite and TikTok for months on end. And of course, we reframed our collective view of Big Pharma. Drugs, even those never fully trialled, were categorically sold as the saviour of the world. Nobody talked about vitamin D deficiency and its role in severe COVID, sunshine, vitamin C, a healthy immune system. No, we weren't allowed to mention them. Pfizer and AstraZeneca, they were the only way out of this. Anybody that suggested otherwise was censored and cancelled. We have primed a whole generation to believe that pharmaceuticals solve everything. And those companies are rubbing their hands together now. Mental health problems skyrocketed during the pandemic, and those drug companies are now lining up to generously provide a quick fix. After all, it is much easier and much cheaper for a GP to tell you to pop a pill than to address the root cause of our collective malaise. And that's not to say that ADHD medication, which is basically amphetamine, by the way, does not have some success in some people in some instances. Anecdotally, I, for one, know of many families who say that it has transformed their lives. But these aren't just harmless little tablets that should be liberally distributed to someone who can't concentrate, maybe because they don't watch or listen to anything in life longer than a 7-second TikTok clip. ADHD medications can have serious long and short-term side effects. We are potentially looking at a whole generation becoming dependent on medications they don't need or wouldn't have needed if they hadn't upended their lifestyles under the guise of controlling a virus in a pandemic. And what about the long-term effects? How will this surge in ADHD diagnoses and prescriptions impact our society in years to come? Will we see a workforce increasingly reliant on stimulants just to get through an average day? What about our children growing up in a world where every fidget or daydream or period of boredom, frankly, is pathologized and medicated? The role of social media, of which I am ordinarily a big fan, has been significant in the increase of ADHD symptoms and prescriptions during and after lockdowns. Research indicates very clearly that excessive social media use is linked to higher levels of ADHD symptoms in adolescents. A study examining adolescents at risk for psychopathology found that the daily number of text messages sent and time spent on digital media were related to self-reported ADHD characteristics measured on the same day. Additionally, the number of social media accounts that an adolescent has positively correlates with ADHD symptoms, as well as other issues like oppositional behaviour, anxiety, depression, loneliness, and that teenage norm of fear of missing out. The lockdowns exacerbated these problems as screen time and social media use increased dramatically. Total media time rose by 46% during lockdown for children and adolescents with ADHD and did not fully return to pre-pandemic levels afterwards. This increased exposure to social media and other screen-based activities will have inevitably contributed to the worsening of attention deficit symptoms and therefore the subsequent rise in prescriptions. But there are two sides to this, as those with ADHD already are particularly vulnerable to the addictive nature of social media. The constant connectivity and instant gratification can lead to more problematic use. The study found that patients with difficulties concentrating, high irritability or deterioration of ADHD problems under lockdown spent more time with screen media than those with milder or no such problems. Quelle surprise. We need to have a serious conversation about the true cost of lockdowns, not just the economic toll, which we know continues to be devastating, but the profound impact on our mental health and well-being. We need to hold those responsible for these decisions accountable for the consequences of their actions. The British COVID inquiry is based on the assumption that lockdowns were fundamentally necessary. No, they were not. There is no evidence anywhere in the world that they reduced death. In fact, the long-term effects have seen quite the opposite. And let's not forget the role of the mainstream media in all of this. Where are the headlines screaming about this ADHD epidemic? Why isn't this story plastered across every front page and leading every news bulletin? Well, could it be that it doesn't fit the narrative of lockdowns as being completely necessary? Could it be that newspaper editors know that they are culpable for taking government money and they can't now admit that they were wrong? So what can we do about all of this? Well, for starters, we need to demand more impartial research into the long-term effects of lockdowns on mental health, particularly in children. We need to question the rush to medicate every problem and look for more holistic solutions with fewer side effects. And most importantly, we need to learn from this experience, not to turn a blind eye. Because the next time the powers that be try to convince us that locking ourselves away is for our own good, we need to remember the hidden costs, the anxiety, the depression, the family breakups, and yes, the skyrocketing ADHD diagnoses. Let's not allow ourselves to be ever fooled again. Our mental health and that of our kids is too precious to be sacrificed on the altar of questionable public health policies. Whenever we get the chance, we need to speak out and reclaim our right to live full, free, and unmedicated lives if we choose to do so. Because if we don't do it, who is going to do it for us? This is Bev Turner, signing off for GBN Originals. Don't forget to subscribe to the GB News YouTube channel. And remember, especially when it comes to you and your family's health, stay vigilant.